Hello, my name is Ian Appleyard. I am the Research and Policy Manager at the British Acupuncture Council. This is a short presentation about the special procedure licensing regulations that will be introduced into Wales shortly. The British Acupuncture Council does have some concerns and also has some suggestions about how these regulations can be best used to support public safety. I will first provide an overview and then go through the issues in more detail. There are good things about the new licensing regulations. They will provide a consistent approach throughout Wales. In addition, anybody who obtains a license to practice acupuncture must have undertaken a hygiene course. However, there are limitations. There is no assessment of the practitioner's knowledge of acupuncture or Western medicine, and there's no clear means by which a member of the public, if concerned about the professional behaviour of a licence holder, an acupuncturist, can raise concerns. This means that people seeking acupuncture still have some questions to ask before they can be assured that their practitioner is competent, safe, knowledgeable, and adheres to professional codes of conduct. There will be an increase in cost, and these most likely will be handed on to patients, as most practitioners work in private practice. There is a solution, and the licensing regulations could make better use of the Professional Standards Authority accredited register scheme. There is going to be a public-facing license holders register which people can access via the internet. We believe that a link to the PSA accredited registers from that website will help members of the public find safe, competent professional practitioners. Secondly, a fee waiver for acupuncturists who belong to PSA accredited registers will resolve the problem of additional costs. I will now go through these issues in more detail. We'll start by looking at the background to licensing and then cover what the British Acupuncture Council fed back to the Welsh Government during the consultation process. There have been some changes that we welcome, so I will discuss those and then reiterate the recommendations with a bit of extra explanation. Local authorities have had the power to license acupuncturists for over 40 years. The origins, or the motivating principle behind this legislation, was to protect the public against unhygienic practices. So this is from a debate in the UK Parliament 1977 because of an outbreak of viral hepatitis B that occurred in Birmingham. It was at least 35 people were infected. Hepatitis B is a serious condition with fatalities and long-term effects on the liver. So clearly there is a need to make sure that those who are practicing acupuncture have a good understanding of hygienic practices. So the first legislation came into effect in 1982 and it's subsequently been amended and built upon in various other acts, for example one that applies to Greater London, then Scotland, and now the Public Health Wales Act 2017 is applying new regulations to the whole of Wales. So before we start looking at the consultation process, it's probably a good idea just to backtrack a little bit and look at the Healthcare Act itself. There are some important bits of information in that which I think are relevant when we come to understand the concerns we wish to put forward and the solutions to help protect the public. The British Acupuncture Council is an accredited register of the Professional Standards Authority. Because of that status, the original intention of the legislation was for members of the British Acupuncture Council to actually have an exemption from the licensing requirements. Special procedures includes not only acupuncture but also body piercing, tattooing and electrolysis. So each of these professions have very different requirements. Because of that, the policy intention was that the licensing criteria would be developed to take account of these different procedures and their different requirements. The Public Health Act 2017 does include a provision to exempt individuals who belong to a Professional Standards Authority accredited register. So now I'm going to cover what it is that we fed back to the Welsh Government during the first public consultation. We very much welcome certain parts of the proposed regulations. For example, it brings a harmonious approach across Wales. In England, sometimes local authorities will take a different approach to licensing, and that can be problematic, and we think a nationwide approach is the better way to go. Significantly, it also means that anyone practicing acupuncture must have done at least a basic course in hygiene, and we believe and agree that that is a good thing. However, there were a couple of areas of concern. First of all, the licensing makes no assessment of someone's knowledge. So that's no knowledge of needling procedure, like the proper depth, proper angle for the needle to be inserted, which is important for safety. No knowledge of Chinese medicine theory, no knowledge of Western medicine, which can be very useful when identifying red flags and things such as that. There is also no professional conduct assessment, or no means for someone to raise an issue if they felt they hadn't been treated properly. Now, those two things we believe are naturally expected of when you go to see a healthcare professional. There is currently no requirement for anybody in the country who wishes to practice acupuncture to have specific knowledge and competence in acupuncture. They do not need to do a course which indicates what are the correct needle insertion depths. They do not have to study Chinese medicine theory. Secondly, they are not required to belong to any professional body that will take seriously issues of professional misconduct. So, the proposed regulations were not a change in this respect. However, we did identify what we believe is another risk, namely that when somebody is looking for an acupuncturist, because there is a national register, or there will be a national register, they will go to the register and assume that the people on the register, the licensed acupuncturists, have been assessed not just for hygiene, which they will be, but also for knowledge, competence, and belonging to some body that will take seriously issues of professional conduct. However, from the initial documentation, it appeared that this would not be the case. So we raised this as a concern that people may well be misled by the very notion of a national register. The other issue that we raised was the concern we have about cost. So most acupuncturists work in private practice, and this means that raising the costs, the basic cost of providing an acupuncture service, will have to be met in some ways by the patients who go for that service. So it will possibly mean that acupuncturists in Wales have to raise their prices. Now, this will be potentially less of a problem if somebody is working in a relatively wealthy city area. So they have one clinic and they work there for most of the week. However, if they work in a rural area, which may not be as wealthy, they may have different clinics dotted around to enable access for the patients. Now, if they're having to pay fees for every single clinic, that will mean there'll be a higher cost to be covered. So it will mean that people who live in the lower population density areas, the practitioners working there will have to raise their prices relatively more. So we were concerned that it might even mean that acupuncturists will no longer find running a clinic in poorer rural areas actually worthwhile. So they will withdraw their services, retire early, and things like this. And that would mean people who are currently being served and helped by an acupuncturist will need to go back to their GP or something to help them manage whichever complaint it is that is troubling them. I now want to talk about acupuncture safety in general and some other concerns that are important to consider. A couple of reasons for this. First off, I do not want people to feel alarmed. Acupuncture is a very, very safe intervention. However, there are some risks. These need to be understood, and we believe understanding of the risks should be embedded within the regulations. Over the past 20 years or so, we have built up a considerable amount of research on acupuncture safety. So these research papers include a total of over 12 million acupuncture treatments. The conclusion is that acupuncture is safe when delivered by properly trained practitioners. So we can say to people, do not worry, go and see an acupuncturist and be confident that they won't come to harm, because acupuncture is a safe intervention, but it has to be delivered by somebody who is properly trained. When thinking about the harm that can occur from any medical intervention, including acupuncture, we think about adverse events. Now, for acupuncture, we can split them, let's say, into two, these errors and the side effects. So at the top of the list in terms of errors, I would put pneumothorax. This is when the needle is inserted too deeply at the wrong angle and it actually damages the lung. So this is a very serious event and you would need to go to A&E and they can help you and everything should be fine, you should recover, but it's definitely something that we have to avoid. With proper training, the chances of pneumothorax should really be right down into the almost theoretical chance of happening. Similarly for infection, proper hygiene procedures shouldn't be causing infections. I know with the new regulations there will be a test on knowledge of hygiene, but there are some particular things with acupuncture that a good training will help you understand. So with ear acupuncture, there's a bit of a risk, additional risk for someone who has a heart valve causing myocarditis. Now, that's not going to be covered in the basic hygiene course, but on our accredited courses, that will be covered. So a good rounded understanding of all the risks can absolutely minimize the chance of any of these errors ever happening. There are some things, which let's call them side effects, which will happen. They're almost part and parcel of having acupuncture. Not every time, but in the course of a treatment or in the course of a practitioner's week or month, somebody might get one of these. They don't happen very often, but they do happen. So people might faint. These can be minimized, avoided by making sure the patient's not hot, not hungry, not stressed, not thirsty, etc. And they can be taken care of. It's very temporary. Tiredness is another thing. Sometimes people actually feel the tiredness is a good thing as it helps them rest. But a little bit of care and attention, and it means that somebody avoids potentially driving immediately after having acupuncture, or the practitioner's trained and just says, look, you're not fully recovered yet, take a moment, don't drive. So all of these, we can minimize the risks to the patients, to the general public when having acupuncture with good training. Other concerns that have been raised with regards to seeing an acupuncturist outside the NHS is the potential for delayed diagnosis and or encouraging patients to stop medication. In both of these cases, however, research has been done and that showed that there was no evidence to support these concerns. However, once again, that research was done on British Acupuncture Council practitioners, and it found that when acupuncture was provided by BACC members who belong to a professional association and are well qualified, this is not really happening. In fact, the evidence actually indicates that quite often the acupuncturist is recommending somebody go back to see their GP or their hospital consultant. So now I will describe what it takes for a professional organisation such as the British Acupuncture Council to assure the safety and professionalism of its members. This slide illustrates some of the key parts of the British Acupuncture Council's work that goes towards assurance of safety and professionalism. On the left-hand side, there's a small diagram that illustrates all the work that goes in behind the educational system, that we have to have a proper, fair, transparent system that ensures that the colleges who train acupuncturists to qualify to join our organisation are well trained and well qualified. In the middle, there is our complaints or raising concerns procedure, which is clear and transparent and on our website, so any member of the public can access it. And on the right-hand side, all of this is underpinned by our codes of professional conduct, our educational standards, our safety guidance for members, etc. All of this combined does cost money, and that money is paid for out of British Acupuncture Council's membership subscriptions. So it is your practitioner who's paying money towards the maintenance of assurance of safety and professionalism across the United Kingdom. Early in the presentation, I mentioned that there is no law or regulation that ensures that an acupuncturist has specific knowledge of acupuncture needling techniques, of acupuncture theory, of Western medicine. It's not a statutory regulated profession, and therefore pretty much anyone is in a position to set up and call themselves an acupuncturist. In a similar way, we have a similar problem with organisations. So anyone can create a website, establish a company that purports to be an acupuncture professional association. Because of this, the British Acupuncture Council feels it is incredibly important that any organisation that calls itself federation, calls itself association, council, whatever, representing acupuncturists, that it's a professional body, is willing to put itself forward for independent verification to show that it does take complaints from the public seriously, and there's a clear and proper process for doing that it does put money into developing professional codes of conduct, professional safety codes and guidance and educational standards, and the whole system of educating practitioners is underpinned by a good accreditation process. At the moment, there is one way in which we can assure there is independent verification of all of our standards and professionalism, and that is the Professional Standards Authority accredited register scheme. Now, the British Acupuncture Council has been an accredited register since the scheme started. The Welsh Government provided a response to the feedback that organisations and individuals had given during the first round of consultation. I want to pick up on one issue from that feedback, and then I will talk about what we put forward during the second consultation. In the response to the first round of consultation, the Wales Government stated that they were not able to grant exemptions to one professional body based solely on the body's own estimations rather than an objective statutory summary. Now, this is actually the opposite of what the British Acupuncture Council had fed back. We do believe it is important not simply to rely on the body saying, we are the professional regulators and we do all of this to establish that our practitioners are well trained and qualified. We had all along suggested that the Professional Standards Authority, which is an independent body set up by an act of the UK Parliament, here to protect the public, should be used as a means to assess which professional bodies were in line, if you like, for an exemption. And of course, as we stated earlier, there was provision for that within the Public Health Wales Act 2017. The second round of consultation provided the opportunity to give feedback on the draft regulations themselves. As mentioned earlier, we were concerned that somebody looking for an acupuncturist in Wales may believe that the licence register included only acupuncturists who not only had knowledge of hygiene procedures, but also knowledge of acupuncture, Western medicine, and were part of a professional body that would take seriously any complaints or concerns that they had. Unfortunately, the regulations don't do this. They just concentrate on hygiene, and there's no assessment of knowledge, and there's no means of assessing or raising concerns with regard professional conduct. The draft regulations would have prohibited acupuncturists from providing patients with home visits unless the person was receiving palliative care. Now, we were very concerned about this, as it would impact on those who, for a whole variety of reasons, would be unable to travel to an acupuncturist's clinic to receive treatment. So mobility issues, age, or just poor public transport would have stopped quite a significant proportion of people from being able to access acupuncture. Since we were provided feedback during the second round of consultation, we've been informed that there will no longer be restrictions on home visits. This is a very welcome change which will support many people in Wales to access acupuncture if they need it. The other welcome change is that there's been greater acknowledgement of the limitations of the register, and as we understand, there will be an advertising campaign and maybe some information placed on the licensing register to inform the public about its limitations, as it doesn't include any assessment of somebody's knowledge or skill or understanding of acupuncture, and it doesn't include any provision of assurance that the person belongs to a professional register, which will take seriously issues of concern if raised by the patients. Whilst these changes are welcome, we do have concerns that remain, and I will cover these now. A key concern is what could be described as the double regulation cost. So, as mentioned earlier, the British Acupuncture Council ensures the educational standards, produces professional codes, professional guidance regarding safety, and this is constantly being updated. That requires money, and that is paid for through the membership subscription fees, which is ultimately paid for by the patients who see the practitioners. So with the licensing scheme adding costs, there is a risk that people will find it unsustainable, or practitioners will find it unsustainable, to provide acupuncture in the poorer, more rural areas. If you would like to find an acupuncturist, you can visit the British Acupuncture Council website. We have a Find an Acupuncturist search function. Pop in your postcode and hopefully you will find a practitioner in your local area. By doing that, you can be assured that the acupuncturist, our member, has a good understanding of hygiene, very well trained, so they have good knowledge of acupuncture, the theory, looking for red flags, and they're also signed up to a professional code, which means in the unlikely event that something goes wrong or you have a concern, you can raise it with us through our open and transparent procedures. And to reiterate, this is simply not the British Acupuncture Council itself saying it. We are an accredited register, so the Professional Standards Authority oversees our work and ensures that we actually do what we say we are doing. But this whole system does cost money. So with the added impact of a licensing scheme, there is of course a risk that people will not be able to afford the membership subscription, and therefore it will be harder for you as an individual when you're looking for an acupuncturist, because you no longer have the ability to find someone in your area who is Professional Standards Authority accredited register practitioner. This means it's harder for you to know whether they have a good knowledge and understanding of acupuncture, and it's harder for you to be reassured that they actually do adhere to codes of professional conduct. The CENEF is due to debate the new regulations at the end of November 2024. The British Acupuncture Council still has some suggestions which we believe will strengthen public safety. Our first suggestion is that the public register of licence holders should have a link and highlight the Professional Standards Authority accredited register scheme. This is the same as the link that is currently on the NHS Wales website, which directs people who are searching for an acupuncturist to use an accredited register practitioner. Our second suggestion is to avoid the cost of double regulation. We believe this could be achieved by a licence fee waiver for those on accredited registers. We do understand that with regulations it is often much better to have a consistent approach. However, we would like to point out that the original Public Health Wales Act did have a provision for an exemption for accredited registers, and also the expectation of the Act is that there would be some variation depending on procedures. So what applies to acupuncture may not be appropriate for tattooing or body piercing. In any event, reducing the fee for accredited registers will help enable those people who are living in poorer rural areas to access acupuncture if they choose to do so. Thank you for taking the time to view this presentation. If you would like to know more about acupuncture or find an acupuncturist, please visit the British Acupuncture Council website.